Rabies. A virus you may have heard of but never personally encountered. Rabies is a complex disease that attacks the central nervous system. When symptoms start to present themselves in the infected person or animal, it is likely already too late and said person or animal will die. Rabies is a disease that, even in today's world, has a 100% fatality rate if one is not vaccinated in time. Rabies has an incubation period typically of 1 to 3 months, sometimes even years. Someone may have rabies and not even know it. Rabies is often transmitted through the saliva of an infected mammal. It travels up into the brain and causes adverse physical and psychological effects. For humans specifically, it causes hydrophobia. Although it sounds as simple as a fear of water, the rabies virus actually causes painful muscle contractions in the throat and larynx, making it very difficult to swallow. Since the virus propagates through saliva, swallowing is detrimental to its spread. Rabies has been around since the dawn of man. Since humans could write and record history, we have found records of the rabies virus. By the time humans were domesticating dogs, rabies had already found its way into the canine species. It had therefore become an integral part of humans' growing relationship with domestic dogs. Through this relationship, rabies has consistently been a looming threat to humans. It was just a matter of time before it began to pop up in literature. Several rabies booms in Central Europe attributed to creating some of our most famous monsters. That would be the werewolf and the vampire. These monsters have a direct link between animal and human, turning into something that is somewhere in between the two, and of course, transmitting the disease via bite. Similarities between rabies sufferers and vampires include hypersensitivity to stimulation and reactions to strong stimuli such as water, light, odors, or mirrors. They may suffer spasms of the facial and vocal muscles, which can cause bared teeth and frothing bloody fluid at the mouth. Those with rabies may also develop insomnia and wander at night. It is not hard to imagine how the birth of vampirism was ignited by the fear of rabies. Of course, during the rabies booms of the past centuries, there lacked a definitive cure for the disease. Throughout history, humans have thought of a lot of very interesting ways to cure rabies. In ancient India, the Sustuta Samhita, an ancient Indian medical book, suggests cauterizing the wound with clarified butter, and to cover the wound with a sesame paste. Ancient China suggests performing moxibustion over the wound. In Greece, not only bleeding and cauterization was suggested, but also applying salt to the bitten area, perhaps even a brine pickle. Pliny the Elder, a famous physician of ancient Greece, had suggested to insert in the wound ashes of hairs from the tail of the dog that inflicted the bite. Pliny didn't stop there though. He also suggested inserting a maggot from the body of the deceased dog into the wound, or putting menstrual blood from a female dog into the wound. He also suggested burning a rabid dog's head to ashes and consuming it, or putting those ashes into the wound. In the Middle Ages, they would cut the worm from beneath the hound's tongue, or as we know it today as the frenulum. Some more eccentric people during the Middle Ages would pull feathers from the anus of a rooster. They would then hang said rooster by its neck and press its anus against the bite wound. This was in hope that it would suck out the toxins. Bloodletting, of course, was also quite popular at this time, and religious treatments were popular as well. One well-known religious treatment, referred to as la tielle, would bind a patient with a sturdy ring to a wall. The patient was then slashed across the forehead, and within the wound a thread of venerated vestment was placed, and the wound was wrapped. The patient was then left bound for 9 days, in which they would pray and fast. At the end of the 9 days, a priest would remove the bandage and burn it. We finally reached a true preventative for rabies when Louis Pasteur invented the rabies vaccine. Pasteur's process was to pass the virus from animal to animal, slowly diminishing the deadliness of the disease with each transmission. With this method, he was able to eventually isolate the virus from rabbits and suspend it in dry air. With this, Pasteur was able to begin immunizing dogs, and his opportunity arose to treat humans when a boy by the name of Joseph Meister was bitten by a rabid dog. After 14 inoculations, the boy was considered rabies-free. This, of course, revolutionized both veterinary and human medicine, and by 1886, Pasteur's vaccine had treated 350 patients from Europe and America. Now, rabies is nearly completely eliminated among domestic animals in North America and Central Europe. There is still a danger of being bitten by a wild animal, such as a bat, raccoon, coyote, fox, or wolf. There are rigorously kept records of animal vaccinations and efforts for some wildlife vaccination as well. It is one of the most effective public health initiatives in United States history. So if you or your furry friend ever find yourself in a situation where rabies might be a danger, Investigate getting that vaccine and make sure to watch out for the full moon.
In the movies, being bitten by an animal gives you the superpowers of that animal, plus other powers. But in real life, the only power you get is the power to die. Learn the facts. Rabies kills nearly 4,000 Americans every 1,000 years. Rabies. Ugh.